Postgraduate training in surgery has been a point of great pride at Michigan for many years. Our residencies, which include general surgery, vascular surgery, thoracic surgery, and plastic surgery, attract talented people from across the United States and have produced some of the most important surgeons in this country. Clinical training is the bedrock of our residencies and will remain our #1 priority. But many of our trainees are also attracted to the incredible research opportunities of the University of Michigan. And the fact is that winning federal support for resident research endangers this important opportunity. We're excited to initiate the Resident Research Endowment fundraising initiative. It's received incredible support. The Department of Surgery has contributed $6 million as seed funds for this effort. The faculty of the department, who know firsthand the importance of resident research, have pledged $300,000 a year for each of the next 10 years to this effort. The remaining funds to come from alumni, grateful patients, and community leaders. Ultimately, this is about our residents. This is about their futures. These are their stories. Thank you for listening.
During my academic development time, my focus was oncology, and specifically, I looked at some of the differences in cancer treatments and cancer outcomes that patients had once they were diagnosed. In the United States, we've seen that cancer rates and cancer death have dropped since the 1990s, but unfortunately, not all populations have really benefited from that. We see that people with socioeconomic challenges and minorities have higher death rates, and the mechanisms that drive the higher death rates are pretty unclear right now. We know that they don't get all of the same treatments that they should be getting, so my focus was trying to identify why this was happening and try to identify some way to overcome those barriers so that patients could get the treatments that they need. According to the American Cancer Society, there are over 60,000 deaths every year that could have been avoided related to cancer because of the disparities that exist in treatment patterns and patients not getting exactly what they need for their cancer care. So in being able to identify some of these barriers, we're hoping that we can identify strategies to get patients to oncologists and to surgeons early so that they can get their cancer treated. And overall, the benefit would be a decrease in cancer deaths across the entire population and not just in select groups. This academic development time really gave me the opportunity to be a surgeon scientist. I had the time and tools to dedicate to learning how to build a research project, how to work on the data analysis, how to come up with a hypothesis, and how to solve problems. And it really gave me the opportunity to just spend my time concentrating on those things. The tools that we're able to learn and use during our academic development time help us identify what needs to be changed in our healthcare system, whether that means coming up with a new drug for cancer treatment or identifying how to better deliver treatment to patients. That improves our healthcare system as a whole. And I think as our healthcare system improves here at Michigan, we'd be able to attract the best and the brightest to the university. I think it makes the program better, and I think it enhances what's going on in the university as a whole, and at the same time, our patients benefit from it.